Hi, my name is Louise and I'm here with Beyond the Room at the International Forum for Quality and Safety in Healthcare, and I'm really excited for my next guest. Do you want to do the honours of introducing yourself?
Yeah, my name's Aly Walker and I am a consultant paediatric anaesthetist from the Royal Hospital for Children in Glasgow.
When I kind of came across you and I tried to say your title, I just couldn't say it, so thank you for kind of clearing that up for me.
That is why I call myself the sleepy doctor, because it's much easier than saying all of that.
So how did you kind of get into this specific role that you do at the hospital?
So my day job is I'm an anaesthetist, and so I spend my days looking after children during their operations. But my passion is also for the world of design and how to use that to make the patient experience better, as well as delivering good clinical care.
So do you want to explain a bit about the kind of project you were designing a new operating theatre, am I right?
That's right, yeah. So we've used a design approach. It's kind of a journey that I've been on for now about 6 years.
Wow.
And it started with this feeling that things could be better. Although the clinical outcomes were really good, the experience that our children and parents and indeed our staff were having, it just could be better. And when I was a Scottish Quality and Safety Fellow, I had learnt a little bit about service design and design thinking, and I took that theory and I just tested it out. And so what we did was we explored our system, we found out what could be better, and we used lots of different ways of interacting with children, parents, staff. We did all sorts of things like interviews, surveys, shadowing, empathy maps, journey maps, just lots and lots of design techniques to find out what it was that could be better. And then kind of in the middle of all that, COVID hit and it really turned everything on its head. And so what we decided to do was just focus on the easy bit being the physical environment. So what we've done really is we've transformed our physical spaces from those kind of cold clinical environments to something that is warm and friendly and filled with empathy. And when people come into our theatres now, I think everyone can see something of themselves within the design. So we've deliberately been very inclusive and represented as many different kinds of people as we can, because we see children from all over Scotland.
Yeah, of course. Yeah. Do you have any kind of specific stories from the process that you're like, yeah, this was like just an amazing thing to see everything come together, maybe from one of the children or?
Yeah, I mean, so there's a girl called Faith, and I'm going to share her story a little bit today during my talk. And Faith is just like a wonderful little girl. She's 5 years old, and she loves to play like dolls. She likes to feed the ducks. She's got this little teddy called Chookums that she always brings with her. And I met her when she was 1 day old, and I had to anaesthetise her for a heart procedure, because in fact she was born with something called hypoplastic left heart syndrome, which means that she was born with pretty much half a functioning heart. So she's had lots of really major heart operations. And I anaesthetised her again recently, now that she's a lot older. And I remember the first time I met her parents, when she was just a baby, and they looked absolutely terrified, of course. And I met them again recently, and I said to her dad, Kenny, what was it like? What was it like to come to our theatres for an operation? And he said, well, actually, we're so grateful to the staff. We're so happy that she's had her operation. And I said, yeah, but what was it really like? And this was before we'd transformed her environment. And he said, well, Aly, actually, it was really frightening. It was very cold, and it was clinical, and it was terrifying. They came back to see the newly transformed space, and they were blown away. They couldn't believe it.
Amazing.
And so, in fact, Faith's little teddy is featured within the artwork.
Oh.
And she came back, and she was, looking at all the different, because there's all these different things to see within the artwork. And she said, how did you know? How did you know that we liked all of this? So it's just about people seeing something of themselves and people feeling like they've been thought of. It's so important that people feel and know that we care. So it can't just be our actions, but also the environment is so hugely important. So yeah, Faith, her experience sticks with me, but it's just, in general, it's been lovely to see the transformed area and to just watch how parents and children now move in that space. They're distracted by the new changes that we've made, and they clearly feel calmer and are more welcomed.
So in terms of looking forward to the future, do you have any other ideas for how we can kind of transform the kind of quality of healthcare for patients, or in any other practices or areas?
Yeah, I mean, the job is never ending. So I think what we've created in Glasgow is a really nice case study, a really good example that co-design, it works. When you involve, surprisingly, children, families, young people and staff in the design of something, the solution that you come up with is so much better. And it's my ambition to share that message, and to share that message widely, and to help other people on their design journey use this, because it takes a little bit of bravery to do something a little bit different, but it's always rewarding.
Yeah.
So for me, I would like to see the scale up of what we've done within our hospital, within our health board, within our country and beyond. So I'm excited to be here so that I can meet people from other places and maybe help them on their design journey.
Yeah, no, definitely. I mean, I do a lot of kind of helping people to co-produce in so many different areas, but mainly in the mental health space as well. So I understand people are like, how do I do this? Where do I start?
It's key.
And and just having that kind of guidance is so helpful to them. And during the process, you're like, yes, this works. Obviously it works, but you just have to try. So
you just have to get stuck in. You get your hands dirty. You have to stand up from behind your desk and go out and speak to as many different kinds of people as you can. And actually, what it's brought to me is a richness within my job that I always had a rich job anyway, but really this has elevated it. And it's been enjoyable.
Yeah, amazing. Thank you so much.
Thank you.